presentation on the overall group health ecosystem and the reach to the offline, right? So it's a hugely important, and they have a little time to spend on research and learning. So we're building a holistic platform we call a Bloomberg for doctors, right? Some of the investors here, you should be well versed with the Bloomberg machine, right? Something similar to help them achieve better outcome in their clinical responsibilities as well as in their research and learning tasks, and enable disease control. So this is mainly working with the public health entities on infectious diseases, right, such as COVID-19, as well as the chronic diseases, right? As Jessica mentioned, that's the real pandemic in China. 400 million people chronically ill or at risk. So how to, in a resource shortage situation that we're in right now, how do we use technology to enable humans to better treat these patients and help them manage their conditions? And another relatively new area that we've entered into is pharmaceuticals or the medicines field, right? Here we partner with some of the leading players in the world to use technology to, again, enable their operations and hopefully come up with new drugs as well as new standards from anything ranging from Western medicine to traditional Chinese medicine. Yeah, so these are one government and the 4 key stakeholders in the offline ecosystem is who we serve and who we work with. And so the first point, right, the market is very big. So here, for example, you can see in public health, 200 billion, hospital spending already 1.4 trillion. But as Jessica mentioned earlier, still a lot of room to grow. If you especially look at the U.S. numbers, much bigger as we go into aging society and growing affluency. And so we're hoping that we're not just a technology provider. So here our revenue models is 3-pronged. So one, obviously, the most basic one is yes, we provide systems to the various parties. But the second one is since we have the AI capabilities, we are hoping to charge with a subscription model, so software as a service, for example, in medical imaging for our chronic disease management robots, etc. And the third is value-added services. So, for example, we're partnering with Good Doctor, who Fang Zong just talked about earlier, to offer their services to the patients that we manage through the public entities as well. So that's a transaction-based model utilizing the whole PingAn ecosystem. So that's our overall approach and strategy, and our positioning is different.
那我们的定位跟很多其他的传统的 IT 公司有什么不同呢？跟互联网公司有什么不同
？IT companies obviously very deeply embedded with the entities since they provide a system, but they're they're a little bit lacking in some use of the new technology such as artificial intelligence and such, right? And they also don't have the value-added services that they can provide to, say, patients or doctors. So they just provide a system. And if you look at the internet companies, a lot of them, they have a very strong online patient flow. So a lot of them sell pharmaceuticals. They provide related healthcare services. But, they're not integrated. They're not deeply embedded to the offline providers and ecosystem, right? So they tend to be a little bit light touch. They tend to be rather limited in their scenarios or use cases. But we see ourselves as sort of in the middle, right? So, we have the software platforms that enable these entities, so we're deeply embedded, but we also differentiate through the use of AI. Jessica mentioned competitions and medical journals that we publish, the 3,000 AI models, etc. But we add on top of that value-added services from our internal partners such as PingAn Good Doctor and external partners. We also work with other hospitals that can provide, for example, telemedicine services to chronically ill patients, etc. So that's how we see our positioning and how we differentiate against some of the more common players in the market. And as you can see on the right-hand side, even though we're only about 3 years old, we, in terms of the coverage, in terms of the core capabilities, we're actually sort of in the first tier or quite leading in these areas. And so again, just to reiterate, right, broad coverage, and even during the COVID-19 crisis with SmartHealth, the largest hospital, to help them better treat type 2 diabetes patients using AI through data mining, right? I've talked to a few CEOs of hospitals. They don't even know how much medical supplies they have left in the inventory. They don't know the profitability of a department. They don't have 360-degree views of the patient. So there's a lot of replicated steps for the patient to go through. Sometimes the patient needs to go through at least 3 payment stages, 3 diagnostic and testing stages just to see the final specialist that they're waiting for. Right? So you've all heard the term, wait in line for 3 hours and see the doctor for 5 minutes, etc. So these issues we're hoping to address through this. And we employ 3 models. So one is sort of piecemeal. So one of these solutions, whatever the hospitals they feel that they have a need for, they can pick and choose, and we do that. And the second is, similar to Good Doctor, right? We can bridge the link and co-build the internet hospital for the hospitals offline, so that they can get that additional online flow and extend their services outside of the offline physical vicinities. And the third is, that we've been experimenting is to co-manage a hospital with the entity, right? So we have a team of specialists that go in and really look at it from the top down, because sometimes it requires organizational changes, workflow transformations, etc. It's not just a systems thing. So So there are, from sort of shallow to more deeply embedded various models to work with the hospitals. We're hoping that this will we'll be rolling this out later this year and early next year. And so far, our technology solutions have already covered over 100 hospitals who use our various services. We're hoping to expand that. And doctors, right from Jessica's presentation, if you remember, we're short about at least 1 million doctors, and maybe, by some estimates, over 10 million nurses, right? So these are the doctors that we do have are really overworked. They often don't have a lot of support in their research and learning. They do that on their own, mostly through various tools and online websites and such. So what we're hoping to build is called Ask Bob. We're hoping that would be a Bloomberg for doctors, where they can go on for their clinical needs, right? Clinical decision support to help them be more efficient, higher quality when they're treating patients, and as well as their research and learning needs. And Guotong will talk about how we're enabling that with our health databases and knowledge bases and so on. But for example, on the clinical side, right, we cover over 3,000 diseases. The machine, through reading a doctor's input on the patient conditions, can give recommendations on how to diagnose and eventually how to treat the patients. It's doing that by going through over 30 million medical literature that we have in our knowledge bases, so that it's essentially a virtual doctor that's always up to date with the latest medical knowledge, right? And late 2018, early 2019, we did a trial with the Fudan Zhongshan Hospital in Shanghai, where we put two teams of GPs, general practitioners, against each other. So they're looking at 10 cases. Same cases, and they're supposed to give treatment plans. And one team used our tool, and the other team didn't. And the team that used our tool scored an 86 out of 100, whereas the team that didn't scored around a 51. So that shows that shows you the power of this, right? We can really improve, especially the GPs and the community level and the village level doctors who are not maybe that experienced in certain areas of treatment. For example, in medical imaging, right? During the COVID area, we came out with the pneumonia CT lung model, and so that's one that's being used in Romania and the US, etc. We're able to reduce the image reading time of radiologists from 15 minutes down to 15 seconds, right? Because the patient volume was really high. A lot of patients were being rushed, for example, in Wuhan, right, where there was the center of the pandemic. So we're able to save the doctor's time, as well as raise the level of accuracy, right? So we had an accuracy of 98% in quantifying and locating the lesions from the pneumonia, so they can further diagnose it and treat the patients, right? And in research and communication, we're helping the doctors, find the newest literature from the newest clinical trials in a one-stop shop. We can answer queries from their peers. So we're building a network of doctors in online forums, so where they can do community learning. For example, we've already done over 100 surgery broadcasts this year, and many COVID-related forums with the top experts in the country. So that's a tool that we're rolling out, and it also has big synergies with what PingAn Doctor is building as they're rolling out their doctor workstations to the doctors that they work with. So we tie these together to holistically serve the doctors even better. And the two disease areas, one is obviously infectious diseases. And during the COVID crisis, we're working with local governments as well as national governments, including the state council. Right, we provided daily reports. We started in the first week of February. We've done over 160 issues. It was a daily prediction report on the trends and the confirmed case predictions for the next day, and as well as 7 days in the future. And so it helps the government make decisions quicker. We're using data from online sentiment data, online consultation data, as well as the published COVID data from the various cities and provinces to do that. And now we're working with over 5 provinces and cities to build the next generation, what we call infectious disease control platform. So it's 3 things. So one is, first we need to alert, right? So we are not just using data from hospitals, but we're expanding that to pharmacies. For example, who's buying fever-related drugs, right? School data, right? Which children are missing school because they're sick, and etc. Right? And also online data. So we can alert if there's a spike in any of these activities, right? So imagine, if Wuhan had acted, say, 14 days earlier than they did, right? You would be able to contain the situation much faster, right? So that's something that we're working with the National Health Committee on to build this next generation system. And the second, I mentioned before, prediction capabilities, doing decision-making, resource allocation, and the last step is to prevent, right? How do you take steps to prevent? So we've this voice robot AI. During the pandemic, we helped several districts of Wuhan to make calls. So these robots make calls to check on citizens who are suspected to have the virus. So we did about 60,000 of these and found about 1,000 suspected cases who then went for testing offline, right? Because the volume is so big, humans cannot do this quick enough. And we help the doctors, for example, the imaging, right, to help the doctors and especially the first line workers in the community hospitals and the clinics, help them better diagnose these conditions, and essentially will eventually help the government make better decisions on medical supplies allocation and where to place the gaps and come out with containment policies. And chronic disease, as Jessica mentioned, right, it's a condition that affects about 400 million people in China. And the lack of medical personnel means that they're not well managed, right? For example, diabetes patients, the awareness rate is less than 60%, right? That means 4 people out of 10 with diabetes, they don't even know they have the condition, right? The control rate is less than 20%, right? So people who are, diabetic, they're managing their disease to a satisfactory level, is not that good, right? So, we're also working, with the various, public health entities in this area to first, help them screen and predict. So for example, in Chongqing, for COPD patients, we built a model using their public health records that can predict people who have COPD or high risk with an accuracy of over 80%. So the government can precisely select people to screen for the disease, right, and get vaccines, right? So it prevents them from developing pneumonia and other related conditions later on. In treatment, right? For example, we're working with SmartHealth on type 2 diabetes, right, to have this tool that aided doctors using big data to see, which comorbidities, right? So it's a related disease caused by diabetes, that they should focus on because it has very different treatment paths. And we're seeing results from retrospective studies of comorbidities happening at a 30% lower rate, right? So, and this also decreases the overall spend for the government as well as the patients, right? So we're potentially hoping, and of course the management tools using AI to do follow-ups, to do patient education, so we save time for the nurses and the doctors, right? So we have a project with the China Medical Society here, we're managing about 60,000 type 2 diabetics, and using this, we're seeing, blood sugar rates, control rates, say five times improvement, as well as only at a 30% cost compared to pure human who are doing this. So, this has synergies with potentially our insurance customers, with patients who are on good doctor, etc. And last but not least is pharmaceuticals. It's a relatively new area. Obviously, this area is very high barrier, long-term investments. So we've chosen to partner with world-leading players. For example, on pharmaceutical R&D, we're partnering with Shionogi, which is a leading pharmaceutical company in Japan. We have a JV with them to really look at infusing technology to aid in the drug development process. For example, drug repositioning, right? From our health knowledge and databases, which Guotong will talk about during the COVID area, we're actually able to find 10 compounds that might be able to treat COVID-related symptoms, and now actually 6 of them, from both China and the U.S. are in clinical trials, right? So drug positioning shortens the time to find the compound and its potential use cases, as well as we're working with the military hospital of the East region in Nanjing to find patients who are more suitable to immunosuppression therapies for renal diseases, right? Because for a drug to be effective, it has to find the right patients. Not every drug works for everyone. So really using technology to improve the development speed, shorten the development time window, and increase the efficacy in terms of patient selection, and so on and so forth. And the second thing I want to talk about is traditional Chinese medicine, right? It's a 400 billion market in China, and we're working with Sumura, the leading TCM manufacturer in Japan. They have 80% of the Japanese market, to come up with standards to improve the quality and production quality of drug makers in China, because Sumura, they have standards on over 300 medicinal plants, as well as over 130 traditional Chinese prescriptions, and medicinal plants, as well as over 130 traditional Chinese prescriptions, and we're hoping to import that to a technology platform here to enable the industry that's been plagued by uneven quality. So 30% of the qualities of the medicinal plants don't pass the quality checks every year in China, and we're developing tools for that, right? For example, AI imaging to tell pure breeds from sort of mixed hybrid plants that have less efficacy or less safety. And so due to the time, this is all I'm talking about before I hand it off to Guotong. So hopefully you leave away with, right, the offline market is huge, and we're using technology enablement to really penetrate the offline stakeholders and the service providers. And we're working with the government to rapidly cover ground, technology is our fundamental source of differentiation, which Guotong will talk about.